My name is Dr. Michelle Bean, and I am a chiropractor out of Santa Cruz, California. And one of the techniques that I use in my office, I've been doing this for the past 10 years, is called Nasal Specific Technique. Yes, that's right, I said nasal, so the nasal structures. It doesn't mean I'm adjusting the nose. The way that we use the nasal specific technique is to literally adjust the bones of the entire skull. So I don't know if you're familiar, we have 22 different bones in the entire skull. So 8 in the cranium and another 14 in the facial plates. And what happens is we have these sutures in between these different plates, and they're designed to expand and contract, right? So with respiration and with breathing, they expand and contract, and the function of this is to give feedback and information to the neurological systems of the brain and the central nervous system. It's also involved in the flow of cerebral spinal fluid, so that's the protective mechanism of the brain and the entire spinal cord. It's also involved with lymphatic drainage, so drainage of all the mucus that we have into the system, so the elimination of toxins from the body, and also blood flow in and out of the system. We also can understand that life is motion, right? So we get sensory information from our outside world, and we get a lot of that information through the joint systems of the body. The receptors send information and signals up to the brain gets the signal and then sends something back. So that's through motion. But what happens is when these interarticulations stop functioning, when they stop moving, we don't get that same information. We don't get the same amount of information into the brain, so that we don't get the same output, right? The amount of input creates a certain amount of output. So this is really important. The way that this nasal specific works, it's actually one of the most profound adjustments that I've ever done in my practice. And again, it's because we can allow the expansion and contraction of those sutures, the very, very subtle motion in between the plates of the skull. So we take, it's a little balloon, it's about the size of a small finger. It's got like a little finger cot. We have 6 nasal passageways. So the reason it's called nasal specific, because I am using the nasal structures. Directly behind the nasal structure is 52 different parts of cranial interconnection. That's a lot of interconnections, right? That's a lot of motion, a lot of ways that we can get stuck. Also one of the most profound ways to expand and move all of those articulations in the entire skull. So we take the little finger cot, it goes into the nose, it sits at the end of a blood pressure bulb, and so it's a little contraction, so I expand it into the nasal structures, and then it quickly comes out. And what this allows me to do then is to adjust those sutures from the inside out to return and get that expansion back into the skull. So some of the reasons that I've seen this locking up of the sutures over are things like concussions, sporting injuries, MMA, football is a big one, definitely car accidents, whiplash, any kind of trauma or blows to the head can cause this. The reasons that people come in to see someone like me for a nasal specific: breathing problems, chronic sinusitis, dripping of the nose, migraines, headaches, snoring. We're changing the sphenoid, the way that the sphenoid, which is the most central part of the cranium, which houses the pituitary gland, we're changing the way that that articulates with all of the different structures.